we've done the Botox treatment for these 3 areas, which will kick in and start working really within a day or so, but you see the full effect by 2 weeks, and you can see there's really almost no residual effects from that treatment. Sometimes there's a little bit of redness. Now we're, with the fillers, we're going to fill in a little bit of this mid-face hollowing, a little bit of the dark circle under the eye, a little bit of the shadowing here. Okay, so look way up high. That allows me to see. Okay, close your eyes. Okay, look up high again. So you can already see the improvement. This hollowness here is gone. The dark circle under the eye in this area is already better. And just hold a little pressure to avoid any bruising. And look up high again. You can see there's a little bit of hollowness right in here, so let's fill that in. You can see the results immediately with the Restylane, how that spot has just gone. Okay. Now we're just going to do a little bit more here laterally. You can see where we get a little hollow around the bony rim of the orbit. Gets a little bit hollow right inside there, so that's an area we want to just fill in, that little contoured area, so we're going to do that right now. More here. See how we layer it in. Okay. So let's take a look. You can let go now. Let's get both eyes. Okay, very good. Kathy gets a little bit red with the injections, but that'll be gone in a couple of hours. Of course, they can use makeup right away. There's really no downtime with this. Okay, so we finished. We've done Botox to 3 areas between the eyebrows, forehead, and around the eyes. And then we've done some Restylane to fill in some of the hollowness in the lower lid and in the lateral canthal area where we get a little hollowness here. Soften the nasolabial fold and at the corners of the mouth as well. And that whole thing we took about 15 minutes and was just done under topical anesthesia. You can see there's a little redness in the lower lid, maybe a little redness here, but other than that, very little sign of any treatment. So you can put on makeup and be out and about right away. There's really no downtime. And how was the experience for you? How did it feel?
Well, I know probably on a scale of 1 to 10, I would say probably maybe just in the range of 1 to 2. So it was actually almost painless. I was quite surprised, especially under the eyes. I felt nothing under the eyes. Botox injections, I've had them before, but I can honestly say it was nearly painless. And I know what the results are going to be, so I'm thrilled with that.
Well, that's the key. These little procedures in the office work fantastic. There's no question about that. And trying to keep the discomfort to a minimum is really the key to success. And with the topical anesthetic and the ice, we find that we can really keep patients very comfortable and really achieve great results.
Mm-hmm. Now, is there any downtime? Anything special that I need to do after the injections?
There really isn't. I mean, sometimes I'll have people use ice if we do a lot of fillers, because you can get some swelling and occasionally some small bruises, so ice can be helpful. Mm-hmm. Certainly if you're not doing anything right now, you could put some ice on. But really other than that, no, there's no special care. It's fine to put makeup on. Obviously you can get a little redness for a few hours from the injections. Makeup is fine for that. But really no special instructions, which is also good. You can be out and about doing things pretty quick.
So it is true what they say, it's a lunchtime procedure. You can have it done at lunchtime and be out and about.
It is. Very good.
Thank you.
You're welcome.